Fetishistic disorder represents a complex psychological condition characterized by persistent and intense sexual arousal from non-living objects or highly specific focus on non-genital body parts. This paraphilic disorder goes beyond typical sexual preferences, creating significant distress or impairment in the individual's daily functioning. The condition involves recurrent and intense sexual fantasies, urges, or behaviors involving the use of non-living objects or a highly specific focus on one or more non-genital body parts. These objects, commonly referred to as fetishes, can range from clothing items like underwear, stockings, or shoes, to materials such as leather, rubber, or silk. The fetishistic focus may also center on specific body parts like feet, hands, or hair, which become the primary source of sexual excitement. The diagnostic criteria for fetishistic disorder require that these fantasies, urges, or behaviors persist for at least 6 months and cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. It's crucial to understand that not all fetishistic interests constitute a disorder. The key distinction lies in the level of distress experienced by the individual and the degree to which these interests interfere with normal life activities, relationships, and overall well-being. Many individuals with fetishistic interests lead perfectly normal lives without meeting the criteria for a clinical disorder. The etiology of fetishistic disorder remains a subject of ongoing research and debate within the psychological and psychiatric communities. Several theories attempt to explain its development, including behavioral learning theories that suggest classical conditioning processes during early sexual development. According to these theories, neutral objects or body parts may become associated with sexual arousal through repeated pairing with pleasurable experiences. Psychodynamic theories propose that fetishes may develop as a result of early childhood experiences or trauma, serving as a defensive mechanism against anxiety or as a way to gain control over overwhelming emotions. Biological factors may also play a role, with some research suggesting potential neurological differences in individuals with paraphilic disorders. The prevalence of fetishistic disorder is difficult to determine accurately due to the private nature of sexual behaviors and potential underreporting. However, studies suggest that it occurs predominantly in males, with onset typically during adolescence or early adulthood. The condition appears to be relatively rare in the general population, though exact statistics vary depending on the diagnostic criteria used and the population studied. Cultural and societal factors may influence both the development and expression of fetishistic behaviors, as different cultures have varying attitudes towards sexuality and what constitutes normal sexual behavior. Treatment approaches for fetishistic disorder typically focus on reducing distress and improving overall functioning rather than eliminating the fetishistic interests entirely. Cognitive behavioral therapy has shown promise in helping individuals develop healthier coping mechanisms and reduce compulsive behaviors associated with their fetishes. This therapeutic approach often involves identifying triggers, developing alternative responses to sexual urges, and improving overall emotional regulation. Acceptance and commitment therapy may also be beneficial, helping individuals accept their sexual interests while learning to manage them in ways that don't interfere with their daily lives or relationships. In cases where fetishistic behaviors pose legal or ethical concerns, such as theft of fetish objects or inappropriate behavior in public settings, more intensive intervention may be necessary. Medication, particularly selective serotonin reuptake inhibitors, may be prescribed to help reduce obsessive thoughts and compulsive behaviors associated with the disorder. However, medication is typically used as an adjunct to psychotherapy rather than as a standalone treatment. The impact of fetishistic disorder on relationships can be significant, particularly when partners are unaware of or uncomfortable with the fetishistic behaviors. Open communication and, when appropriate, couples therapy can help address these challenges. Some relationships may benefit from education about the nature of fetishistic disorders and exploration of ways to accommodate different sexual needs while maintaining intimacy and connection. It's important to distinguish fetishistic disorder from other related conditions, such as transvestic disorder, which involves cross-dressing for sexual arousal, or sexual masochism or sadism disorders, which focus on psychological or physical suffering. Additionally, Fetishistic disorder should not be confused with normal sexual experimentation or temporary fixations that don't cause significant distress or impairment. The stigma surrounding paraphilic disorders, including fetishistic disorder, can prevent individuals from seeking appropriate help when needed. Mental health professionals emphasize the importance of creating non-judgmental therapeutic environments where individuals can openly discuss their concerns without fear of condemnation. This approach is essential for effective treatment and for helping individuals develop healthy ways to manage their sexual interests while maintaining fulfilling personal and professional lives. Research into fetishistic disorder continues to evolve, with newer studies exploring the neurobiological underpinnings of paraphilic behaviors and developing more effective treatment interventions. Understanding this complex condition requires a multidisciplinary approach that considers psychological, biological, and social factors. As our knowledge expands, treatment approaches become more refined and effective, offering hope for individuals struggling with the distressing aspects of fetishistic disorder while respecting the diversity of human sexuality and the importance of individual autonomy in sexual expression.